Hello, welcome to Brain Boosters channel. Please remember to subscribe before you proceed to watch. And leave a comment. In this presentation, I will be discussing mental health crisis. I will be focusing on immediate management of a person in crisis. There is a specific question sent to me by one of my student followers that I will be answering. The question reads as follows. Mr. Andrew Kyra, aged 30 years, has been referred to your outpatient department with a history of increasing anxiety. This follows a positive HIV test results a few weeks before his wedding day. Mr. Kyra needs crisis intervention. A. Define a crisis 5%. B. Describe the 4 phases of a crisis 40%. C. Outline 3 types of crisis 30%. D. Discuss the immediate intervention to help Mr. Kyra resolve the crisis 25%. My focus will be on Part D, the immediate management of Mr. Kyra. So, this is one of the approaches you can take. Use the following as subheadings. Aims. De-escalation. Triaged assessment. Establishing rapport. Relaxation techniques. Explore feelings and emotions. Maintain safety. Observations. Generate and explore alternatives. Psychotherapy. Review and follow-up. Now, let us discuss the above points in detail. Aims. To ensure the physical safety and emotional stability of the person experiencing a mental health crisis. To assist victim to return to a pre-crisis level of functioning. To prevent development of serious long-term problems. To assist client in the development and enhancement of more effective coping skills and support system. To establish priority for response based on immediate safety concerns. Concerning aims, just write 3 aims, they will be enough. De-escalation. This focuses on stabilizing the client and preventing the situation from becoming worse or uncontrollable. I will move Mr. Kyra to a quiet area. This will reduce panicking. I will be empathetic and non-judgmental. This will promote trust and respect of the patient. I will respect personal space. Keep at least a distance of 1 to 2 meters away. This will reduce anxiety and help prevent acting out behaviors. I will keep my tone and body language neutral, my hands exposed to avoid misinterpretation of my nonverbal cues. I will listen more and talk less. This will allow Mr. Kyra to vent out his frustration and allow me to understand the situation better. I will not argue with Mr. Kyra to avoid making him become defensive. Now let's look at triaged assessment. The following interventions may be considered. I will assess whether Mr. Kyra is violent, suicidal, or is a danger to self and others to ascertain whether he requires treatment within 10 minutes, or the situation is emergency. I will assess Mr. Kyra for concurrent social or health problems that require attention. I will assess Mr. Kyra what intervention is best suited for him, and to whom they should be referred to avoid wasting time of unnecessary interventions. I will inquire Mr. Kyra about the support system and resources available to him. Family and friends, social clubs, church groups, and networks of professional associates are all sources of support. I will assess the level of anxiety Mr. Kyra is experiencing as well as his usual coping methods. I will assess Mr. Kyra's strengths and needs to determine whether he is unable to take care of personal needs such as eating, sleeping, and tending to personal hygiene and safety. Now let's look at establishing rapport. I will introduce myself and allow Mr. Kyra to introduce himself to build some level of trust in the client. I will convey genuine respect and accept Mr. Kyra's feelings and circumstances. I will reassure the Mr. Kyra that he will be helped and he is in the right place. I will demonstrate an understanding of Mr. Kyra's situation and feelings to promote trust. I will avoid appearing threatening to Mr. Kyra to gain cooperation. I will avoid criticizing Mr. Kyra. Now let's look at relaxation techniques. Relaxation training decreases the amount of stress endured in a crisis. Types of relaxation training consist of, but are not limited to, deep breathing, meditation, music and art therapy. I will initiate grounding techniques to help Mr. Kyra deal with distressing feelings and refocus his on what's happening in the present moment. I will initiate physical techniques using Mr. Kyra's 5 senses or tangible objects to help get through distress, such as taking a short walk. I will initiate mental techniques, using mental distractions to redirect Mr. Kyra's thoughts away from distressing feelings and back to reality, for example, describing his favorite task. Now let's look at explore feelings and emotions. I will allow Mr. Kyra to vent feelings and emotions and to validate them by accepting them and recognizing them as understandable. This is best accomplished by using active listening skills, such as paraphrasing, reflective listening, and probing questions. With caution, I will challenge maladaptive thinking and behavior. Challenging responses can include giving Mr. Kyra information, reframing and interpreting thoughts and behaviors, and playing devil's advocate. When used appropriately, these challenging responses help Mr. Kyra take a second look at thoughts and behaviors and to consider other options. I will use active listening skills. Identify feelings and desires. Listen attentively and empathize with the person's feelings. Now let's look at maintain safety. Remove all harmful objects within the environment or move the client to a safe place. I will move Mr. Kyra to a quiet place and allow him to vent out his emotions. I will respect personal space. If Mr. Kyra wishes to leave him alone, I will do so, leave, but come back a few minutes afterwards. If at risk of suicide, I will consider maintaining close contact with Mr. Kyra. If Mr. Kyra is showing signs of violence towards others, I will move him to an isolated room. Now let's look at observations. I will avoid leaving Mr. Kyra alone if safety is not guaranteed in the environment. I will closely observe the client for signs of improvement or worsening of the condition. I will assess Mr. Kyra for risk of suicide and harm to others. Now let's look at generate and explore alternatives. I will draw conclusions about the patient's strengths and needs related to the current crisis and evaluate the potential for recovery. I will tap Mr. Kyra's strengths to improve self-esteem, which also provides the energy and skills for problem solving. I will collaborate and negotiate with Mr. Kyra to come up with options that will improve the current situation, and to ensure that the options selected are owned by him. I will brainstorm about possibilities or ask about what has been helpful in the past to elicit Mr. Kyra's input. Now let's look at psychotherapy. I will encourage Mr. Kyra to ask questions. I will link Mr. Kyra to other healthcare team members such as psychologists for more treatment. Even when Mr. Kyra does not seem to pay attention, I will keep talking to him. I will use concise and simple language. Mr. Kyra may be impaired in his ability to process information. Repeating the message and allowing adequate time for him to respond can be helpful. The last part is review and follow-up. After attending to the client and he has stabilized, I will review and follow up to see how the client is copying up. Thank you for watching.